Right, weight loss jabs.
Yes.
I've been dying to have this conversation with you because a lot of people have been asking me about these weight loss jabs, and I've got a limited understanding of how they work, what it is they do, and it's also gained a lot of media traction lately, which I think you're aware of.
Absolutely, we can thank social media again for that.
Amazing.
Yeah.
And the medication has now run out, and this is causing another problem altogether.
Yes.
So, as a qualified medical professional, can you tell me what the medication actually does and how it helps with weight loss?
Yeah. So first of all, just to put some perspective behind it, obviously, I don't know if people know, I'm an independent nurse prescriber, but also a director of a private medical practice that has previously offered weight loss services. Now, most recently in the press, there was obviously this big push from the government that we were trying to drive down obesity. So they launched the idea that they were going to release these injectable or these pens that basically help you lose weight. It was going to be mainly for patients who were over a BMI of 30, but also had other comorbidities such as high cholesterol, high blood pressure, or type 2 diabetes. So when this initial government initiative came out, obviously patients started looking up this drug, and this drug is otherwise known, the brand name is Ozempic, but the actual drug itself is called semaglutide.
Right.
Ozempic is only licensed for type 2 diabetes, so that means when we're using it for weight loss, we're actually using it as an off-license medication.
Interesting.
Doesn't mean that that's unsafe. There are many drugs we use off license, but we just have to make patients aware that this drug was not intended for weight loss.
Right.
When this government initiative initially came out, the idea was that the regulated and the licensed medication, which will be known as Wagovi, would have been released. Both are semaglutide. One's licensed for weight loss, one's licensed for type 2 diabetes.
Right.
What never happened was the manufacturing of Wagovi didn't really occur. So when people started going online and looking up semaglutide, they were finding Ozempic, and many weight loss clinics, pharmacies were promoting the fact that they could give patients the pens to help them lose weight, which is why now we're in a bit of a mess, because obviously people losing weight have taken the medications of the type 2 diabetics.
Yes. So just to fully understand as well the prescription of this medication. So when somebody's coming to you with weight-related issues, you're obviously guiding them on making lifestyle changes and saying how important that is.
These pens are not a quick fix. Whenever we consult patients, and I might add in our practice, we've never actually offered Ozempic because we didn't think it was right necessarily offering an off-license drug at the time. But we did offer liraglutide, and the difference between liraglutide and semaglutide. Semaglutide is a weekly injection, liraglutide is a daily injection, otherwise known, and probably patients would have heard of the drug Saxenda. And that is licensed for weight loss in the UK. But all my patients I tell, whenever I'm prescribing that medication, it's an adjunct. It's an adjunct to a healthy lifestyle, still monitoring your calorie intake. You can't just take these pens and expect to, well, you will lose weight, but as soon as you stop taking them, you're going to gain that weight unless you've reversed your psychology and actually had some really good nutrition and made some lifestyle changes.
Okay, so as nutritionist and trainer, one of the things that would, I think, concern me would be the fact that if people weren't working out on a regular basis, as in changing body composition, which is helping to speed up their metabolism and also keep weight loss going on a longer term basis, and also managing what they're eating, it becomes, now correct me if I'm wrong, almost like a fad. How a fad diet. So
I hate to use the Cambridge diet, Slimming World, all of
because
them are looking at calorie control.
Because the effect of these drugs, they suppress appetite, correct?
Yeah, so basically with semaglutide and liraglutide, the whole idea is that they help control your blood sugars. Now, you probably as a PT get lots of patients, particularly your perimenopausal and menopausal patients, always talk about these fluctuations of their blood sugars. These drugs do help control that level of blood sugar, but also they delay gastric emptying, so ultimately keep you feeling fuller for longer. So patients will eat and they'll feel full before they finish their meal, and then more importantly, they won't probably then want to eat as much throughout the day.
Interesting.
I kind of describe it to my patients as it's like an injectable gastric band. That is kind of what it's doing.
Yes.
But as soon as you stop that drug, if you have not changed other factors in your life, you are going to gain that weight again.
Yes.
We are getting lots of emails at the moment asking if we can access these drugs. We can't. There really isn't any availability
and
in
what's
the UK.
the delay on these drugs at the moment? Have you got any
Summer
idea?
2024. They're
2024?
At the moment,
goodness.
it looks like that is when we'll be
Whoa.
fully back up with manufacturing, and then hopefully Wagovi will have also be back in, because the idea is that Ozempic will be left for the diabetics.
Yeah.
Wagovi will go for weight loss. But there just isn't Wagovi in the UK at the moment.
Which morally is the right thing to do. Obviously,
Yeah.
we can't have a shortage.
No,
in
these drugs
for
have reached
diabetes.
high government levels. I saw in the
So-
press today.
So, I don't know if you can explain who you would say is responsible for what's happening now, because
Yeah.
effectively, if I don't know the stats on how many people are on this medication.
I imagine a lot.
Right, so we potentially then are facing almost a pandemic within itself of the rebound effect from people not being able to access these drugs,
Yeah.
particularly the ones that haven't been managing lifestyle factors
Yeah.
particularly well, because obviously when you are in a calorific deficit,
Yeah.
the body's in a state of constant
Yeah.
atrophy breakdown.
Yeah.
Therefore, there will be that down regulation of the metabolic
Yeah,
process.
they're going into starvation mode.
Correct.
Almost.
So
yeah.
once the diet is, or the food starts being taken in a high
Yeah.
calorific value, the weight is not only going to go back to where it was, but
Probably go
potentially
even
above.
higher.
So we're
Absolutely.
potentially facing a huge spike in weight-related
Well,
issues.
and I also think what's slightly ironic about the whole thing is that when these drugs were being promoted as kind of helping the obesity crisis, what they've now done is, by stopping diabetics getting their medication, we're actually meaning that they're going to be at higher risk of cardiovascular events, the high blood pressure, the high cholesterol. So we've almost moved one problem from one group of patients and put it back on a group of
My
patients
goodness.
that actually, being type 2 diabetic, obviously we know can be a lot diet related. However, at the same time, it's almost like they're being punished for another group of patients.
I have clients past and present that are diabetic due to the fact that it's hereditary factors.
Absolutely.
So it's not just weight-related issues.
No, and they genuinely can't get their medication. So today an announcement's been made by the Department of Health that all weight loss clinics should be or have received letters to state that we are categorically not to give out the drug unlicensed, so therefore we're not to give out Ozempic. At the same time, I quickly looked on pharmacies this morning. I can't even get either drug, Saxenda or Ozempic. So there is definitely a shortage, but I think what they're saying is if you have got it, you must cease kind of prescribing it, and only the drug should be used for diabetics until this starts to stabilise. I think another thing to mention as well, and this is something that I don't know if you were aware about, because I certainly wasn't until I spoke to our GP at our practice. When this government initiative came out, I had the understanding that a patient could just rock up to their GP, they'd have a BMI over 30, they might have high cholesterol, and the GP would just prescribe the pens. Now that actually isn't the case. Apparently we needed to set up weight loss hubs that the GP might see the patient, refer them into the weight loss hub, because in that weight loss hub you will have the psychological support, the nutritional support, everything to change your lifestyle, not just be given the drug. And that never happened. These setups haven't actually occurred. So I think patients were going to their GPs, trying to get the drugs. GPs were going, I can't prescribe.
Fix.
Yeah, and I think they were going, and the GP was going, I can't give you these drugs.
Yeah.
And then another thing, I think it's quite scary, and again, I did a Google search. You can get these drugs from anywhere, pharmacies, the consultations. You don't even have to see someone face to face.
Was this previous to the shortage
No,
of the
I've
drug?
looked at, well, today I had another quick look. The only thing is that they now say the drugs are out of stock, but in general, your consultation process is just filling in your full details. What's your height? What's your weight? How many times a week do you exercise? They run through a bit of medical history with you. Some ask you to upload a photo, others don't. Some say we need to inform your GP.
So there's no real regulation
Doesn't
around the
seem-
lifestyle factors which go into this.
Doesn't seem like it.
I mean, I'm struggling, to be honest with you. I mean, for what I've done for over 20 years, and obviously I've seen so many fads come and go. That's not just drugs and also supplements, but also diets that have come and gone. And this to me screams of almost another fad.
Yes. Yeah.
Right.
I mean, I think statistically, the patients I have had on Saxenda, they lose weight. I can't sit here and pretend they don't. They do lose weight, and on average you can expect to lose 5% of your body weight, your initial starting body weight, within the first 3 months.
Absolutely. But to go back to the point you already made, was the fact that they can lose weight, but like obviously what's happened now, where there's a restriction in the medication or there's a shortage, the patients that haven't been
changing their other factors are
we're
going to,
going
and they're
back
panicking.
to
They're absolutely panicking. This time we're getting daily emails asking, can you get it? Can you get it? And whereas my patients, unfortunately, I do have a couple of patients that were on Saxenda, but I don't offer a simple injection to treat them. We do have, as you know, we have Natasha, our nutritional therapist. We have you as the personal trainer. So we do have options that we say to patients, this is what you need to be doing. I also make sure all my patients are accountable to me. I review them every month and I'm like, right, how many steps were you doing a day? Have you kept a log on My Fitness Pal of what you've been eating? Because that's the only way I can keep an eye on that they're actually fulfilling everything and not just sticking an injection in their stomach and hoping to lose weight. Equally, I would say maybe we're slightly different in our practice. I will stop that medication if they're not fulfilling the other things.
Which absolutely is the right thing to do from a duty of care perspective.
Absolutely, but I don't think that's probably happening in many places, and also the fact that you can literally buy it from an online pharmacy
without actually even meeting a doctor
who's monitoring it. And also, surely anyone can just put a weight in the scales, pictures, not informing GPs. These medications don't come without risks.
Absolutely.
And the side effects can be high, really high. Nausea, vomiting, diarrhea, constipation, gastric reflux.
And that's the other thing I wanted to touch on is the side effects. So like with obviously a lot of drugs at all levels carries risks. So some of the side effects on a mild level, as you said, were nausea, sickness.
Yeah, I think it's one of those, not too many patients suffer with it, but again, having medical professionals to come to, at least then we can prescribe an anti-sickness, bring them in, we can adjust doses. I can't quite understand how that's occurring if you're doing it purely online.
Yes.
I'm hoping this might have led to them looking a bit better at regulation with regards to stuff like this. But I think at the moment the priority is to obviously get the drugs manufactured.
Yes.
And get the people that actually need them back onto them.
Absolutely. And you said it could be till 2024
until
that's
they've
the
actually
latest.
Restocked. Everyone's saying summer 2024 until we're fully back up to the levels of stock. So unfortunately, you're not going to get access to it anytime soon. And I think patients who are on it, and if you're listening to this, you really need to start looking at those other factors, and there are certainly other things you can do to help so that you don't have to panic because you can't get that additional adjunct to help.
So between now and when that medication is next available, I would certainly say as a fitness professional the best thing to do will be to bring it back to the basics, some accountability with nutrition, trying to focus a bit more on movement. My philosophy is always less is more. You don't have to be going to the gym on a regular basis. Maybe once or twice a week, but the power is always in food. And also trying to move more. So that to me seems to be the sensible option between now and when that medication is available.
We can't deny the fact that that's hard work.
Yeah.
Do you know? I'm being honest.
Of
that
course,
puts in a lot more time, a lot more effort. Whereas obviously injecting a pen doesn't have that level of and if patients are seeing that weight loss, for a lot of people this is a quick fix.
Well, as you said, it was an adjunct, wasn't it? It was never mean to be a means to an end, a cure.
No, not at all.
And I think again, we've touched on this, was perpetuated a lot by Instagram, social media. Celebrities are also taking it. Correct me if I'm wrong, I think even Boris Johnson took it. Didn't he?
I have read today. Apparently he did.
Yeah,
he did.
I don't think it did him particularly.
No, and I think another thing that slightly bothers me is the drugs being handed out, and we already have a problem with body dysmorphic disorder in this world.
The more we speak about it, to me, it is pretty horrendous because all these things, and certainly the psychology of weight-related issues is so deep. I mean, every person that I consult, there's usually a reason why they maybe overeat, and it's not just the physicality of monitoring calories or encouraging people to exercise more and have a better lifestyle. There's a lot of emotional factors that go into making those choices. One of which I always address in the consultation, trying to understand it more. To help with a better prescription of a lifestyle plan. So it just, again, everything which you've told me today, this just screams the fact if people can just get hold of this medication, or they could, but back when it was available, and without any real care or given the right knowledge of how to.
They can just do it, but I sort of compare it to the fact that if in this country, if you wanted to go for gastric surgery, you would have to have counselling and psychological support prior to having that surgery, and that would be monitored. Yet patients will go off to Turkey, have the surgery done, no psychological support, and just get, you know, a sleeve done, which means part of their stomach's removed, with no sort of repercussions to what actually that means for the patient and their psychology behind it.
Yes. Yeah.
So all these
And
things that are done quickly and quick fads, and I'll just pop to Turkey, or I'll just go online and order a pen, is not, it's not the right thing to be doing.
No, 100%. And also, as I back onto gastric surgery, I don't think I've ever known one person that's actually been overly happy with the outcome with that, and that does come with a lot of dietary changes.
It does,
and also dietary
the amount you
restrictions.
can eat, going
Correct.
out for dinners, absolutely.
Yeah, absolutely. So I mean, it comes back to the same thing. I can't stress this enough. There is no quick fix.
No,
there really
not.
isn't.
There's adjuncts that can help, but ultimately, anything to help you lose weight does require some hard work. It requires psychological support. It requires nutritional support, exercise. You know, there's so many more things to it than just using weight loss medication. Weight loss medication works, but it should be used alongside those other factors. It should not be used in isolation.
Fantastic. Look, thanks so much for your time today.
That's
It's
okay.
really,
You're
really
more than
useful.
welcome.
And if people would like to get hold of Romsey Medical Practice,
Yes.
they can go onto your website, your
Yeah,
Instagram page.
absolutely. Like I said, we've obviously ceased all our weight loss services at the moment with regards to medication.
But you do offer
but we
health
offer
checks
lots of other things that we can do to help. Particularly wellness checks. We can run blood tests. We can just check that patients are in their optimal health.
Yeah.
Because that's really important as well.
Okay, thank you so much.
No problem.